What is Ozempic? Ozempic is a brand name for a medication called semaglutide. It's a prescription drug that comes as an injection you give yourself once a week. Ozempic belongs to a group of medicines called GLP-1 receptor agonists, which work by mimicking a natural hormone in your body that helps control blood sugar and appetite. What is Ozempic good for? Ozempic was originally developed and approved to treat type 2 diabetes. It helps in several ways. First, it lowers blood sugar levels. Second, it can help with weight loss. Third, it may reduce the risk of major cardiovascular events in people with type 2 diabetes and heart disease. Recently, Ozempic has gained attention for its weight loss effects, even in people without diabetes. However, it's important to note that while it's being used off-label for weight loss, this isn't its primary approved use. Who should take Ozempic? Ozempic is typically prescribed for adults with type 2 diabetes, especially when diet and exercise alone haven't been enough to control blood sugar. People with type 2 diabetes who also have heart disease, to reduce the risk of major cardiovascular events. In some cases, it may be prescribed for weight management in obese or overweight individuals, though this is not its primary approved use. Who should not take Ozempic? Ozempic isn't for everyone. You shouldn't take it if you have type 1 diabetes, you have a condition called multiple endocrine neoplasia syndrome type 2, MEN 2, you have a personal or family history of medullary thyroid cancer, you're allergic to semaglutide or any ingredients in Ozempic, you're pregnant or breastfeeding. Always consult with your doctor before starting Ozempic, especially if you have a history of pancreas problems, kidney disease, or diabetic retinopathy. What are the warnings and potential side effects? Like all medications, Ozempic can cause side effects. Some common ones include nausea and vomiting, diarrhea or constipation, stomach pain, headache, fatigue. Most side effects are mild and tend to decrease over time. However, there are some more serious potential side effects to be aware of. Pancreatitis, inflammation of the pancreas, changes in heart rate, low blood sugar, especially if used with other diabetes medications, kidney problems, allergic reactions, possible thyroid tumors, including cancer. This is rare but has been seen in animal studies. It's crucial to use Ozempic exactly as prescribed by your doctor. Never share your Ozempic pen with others, even if you've changed the needle. In conclusion, Ozempic can be an effective medication for managing type 2 diabetes and in some cases for weight loss. However, it's not suitable for everyone and comes with potential side effects. Always discuss the benefits and risks with your healthcare provider to determine if Ozempic is right for you. Remember, Ozempic is not a replacement for a healthy diet and regular exercise. It works best when combined with lifestyle changes.